I had a severe pain on my left on the left side, up in the shoulder area, and it was severe enough that it would make me cry in the morning.
So Carl's a very nice man. He came to see me. I believe he lives in Coldwater, and he'd had not really a lot of neck pain, but he had pain and numbness in his arms and hands. He had a lot of weakness, especially in his left arm, and he was just pretty miserable as a result of that.
2 months before the first surgery, that's when it got bad, and then went to worse. And I just couldn't take it anymore. And it started to affect me mentally because I got no relief.
When he came to see me, we looked at some scans of his neck, and he had a couple things going on. His spinal cord was pinched in a couple of different places, and he also had a slipped vertebrae.
So we, through the x-rays, the MRIs, and then the CT scan, he determined that the discs were bad.
So in order to fix that, we had to do a couple of things. We had to relieve the pressure on his spinal cord, but also put his neck in a better alignment.
In March, I started to get a swelling on the right side of my neck, and I couldn't put my chin down on my chest. I couldn't get it down any lower without, I couldn't breathe. And if I was chewing something, I couldn't swallow. I had to lean back. So I naturally got a hold of him right away.
He'd done well for a while, but suddenly his neck had kind of gone back to this, and really in a worse position than he had been before. Throughout all this, he didn't really have a lot of neck pain, but that position of his neck was certainly worse than when I'd got done operating back in November, and it was really a worse position than he had been previously.
Came to down in recovery. The very first thing I did was look around, and I seen those faces, and I lifted my left arm because that's what was giving me all the trouble, and I had no pain.
Again, he did very well after that. He was in the hospital a couple of days, but really ready to go home very, very shortly after, and he's done very well since. He's happy with the new position of his neck. His arms and hands feel much better than they did before surgery, and he's done really well. And he's had such a positive attitude the whole time. He's been a great patient.
I knew all these people from the first time, most of them, and it was comforting. Hi, Carl, how are you? You know, we're going to get you taken care of here. Are you comfortable? Is there anything we can get?
One of the huge advantages of having a small rural hospital is that people know each other.
Going by, the staff that weren't even involved with me, that were walking by before I went under and after I came out. Hi, Carl. Hi. Or I'd say hi, and they'd stop and say hi back. And that was everybody. That wasn't just a few people. That was everybody. Like I say, this hospital is a family hospital. You're working with people that care about you. I
have been working at Hillsdale now for over a year and a half, and one of the best things that's happened to me is the ability to get to know the people that I work with, and really all the people I work with.
It was heartwarming, to say it the least, that I was dealing with people that weren't doctors, nurses, janitorial. I was dealing with family.
I've had a really positive experience, and my patients have as well. And one of the big reasons for that are people are friendly and engaged in their care.
If I have to go back to a hospital for anything, I'm going to come here.